Thanks very much. And actually, this is just for a more entertainment to put you off, to be awake. So the first question is, how many of you guess how many signs are there in nuclear medicine? It's like any other, radiology's got some classical signs. And how many signs are there in nuclear medicine, approximately? There are various signs like panda sign and lambda signs, like that. How many signs are there in nuclear medicine? First question. Your clock starts now. You can answer. 1 to 4 is the choice, and you can press any one button. What's the answer? So, majority have said 57, but in fact there are about 134 signs in nuclear medicine. And I did this literary search and collection from 1970 to 2012 and 13, I think so. So I found about 134 signs in nuclear medicine. It's purely entertainment, but I can't show all the 134 signs. But fortunately, Lenny Freeman has agreed to take this as a full article in seminars. So you'll have 134 signs as an article in seminars sometime in September 2015. So I'll show approximately 35 signs, interesting to keep you engaged. And in between every 5 slides, I'll show a sign which is not related to medicine, but one of my friends from Pakistan sent me these signs, but it'll be interesting. All I want you to do is just enjoy, relax. It's not an exam, it's not taxing, and I hope you will enjoy. So in fact, I took it from 26 journals and 1970 till date. In fact, the first sign was sometime in 1970 of thyroid nodule, I think so, which will come part of the exam. So the first question, what is pyrite sign? Your 4 choices, your clock starts now. Is it Paget's disease, or skull fracture, or fibrous dysplasia, or neuroblastoma? Brilliant. But the answer is fibrous dysplasia. So fibrous dysplasia commonly involves the skull in both monostotic and polystotic disease, and it resembles an eye patch or a pirate's patch. So if you see that sign, it's classical. Even in radiological terms, if you see a pirate sign, it is classical for fibrous dysplasia. Next question, panda sign. Tuberculosis, sarcoid, lymphoma, or HIV? It's on a gallium scan. So panda sign on a gallium scan. '86, very easy. Yes, you are right. Focal accumulation of gallium in the nasopharynx, parotid gland, and lacrimal gland, but it's distinct. So majority have got it right. What's lambda sign? Again, on a gallium scan, is this tuberculosis? But one thing you should remember that I never made all the signs. It's all got a reference for each sign. So all my job was to collect them and make it into a presentation. So I have never coined any sign. So it's not my idea, please. And tuberculosis, sarcoid, lymphoma, HIV. Right, easy one. Sarcoid, distinctive intrathoracic lymph node, resembling Greek lambda sign. But separately, our lambda sign and panda sign are non-specific because you got in other pathologies. With advent of PET-CT, you can see in other combinations also. Abe Lincoln sign or black beard sign? What? It's bone metastasis, Paget's disease, osteomyelitis, fibrous dysplasia. On a bone scan, if you see an Abe Lincoln or a black beard sign, yo. Good. It's Paget's disease of mandible. So if you see this, it's a classical presentation for monostotic Paget's disease. Paget's disease of mandible, majority have got it right. Mickey Mouse sign or mouth face sign. On a bone scan, it's bone metastasis, Paget's disease, osteoma, fibrous dysplasia. It's easy. The tough ones will come late. Correct, it's Paget's disease, which involves the entire spine in a triangular pattern. It's, if you see that, majority of the times it's Paget's disease. Faint kidney sign, again, though it's faint kidney, I'm showing some kidneys there. Hypercalcemia, post-chemotherapy, CIP scan, post-nephrectomy. If you don't see a kidney on a bone scan, I'll give you a clue, you know what it is. Brilliant. It's super scan. It could be a metabolic or a super scan of malignancy. If you don't see a kidney, it's super scan. So in the advent of technology, we always go to a party with friends, but we don't talk to the friend who's sitting in front of us. We keep texting the friends who's not there in the scene. So we don't have Wi-Fi, so better talk to each other is one of the signs they put in one of the restaurants. Coming to stripe sign, whether it's seen in pulmonary embolism, lobar collapse, pulmonary emphysema, pulmonary hypertension. It's seen on a VQ scan. If you see a stripe sign, what does it indicate in most of the cases? Answer is pulmonary emphysema. As you can see, there is a rim of uptake. If it's a pulmonary embolism, it extends throughout. It will be a wedge-shaped defect. But if you see a rim and a central photon deficient area, it's unlikely to be pulmonary embolism in most of the cases. So it's unlikely to be pulmonary embolism. It's pulmonary emphysema. Hot patella sign, metabolic bone disease, Paget's disease, trauma, or if you see a hot patella on a bone scan, it's of no diagnostic value. Correct. It's of no diagnostic value because there can be multiple pathologies. Most often we call degenerative. It can be anything. But if you see unilateral, it could be a fracture or it could be patellofemoral maldegeneration and all sorts of things. But generally, it's not of any sinister background. Tram line or double stripe sign, shin splints, stress fracture, metastasis, HPOA on a bone scan. Very good. HPOA, classical pattern, tramline sign. So I don't have to explain because majority of them got the answers right. Honda sign, pelvic fracture, pelvic metastasis, sacroiliitis, Paget's disease. Answer is insufficiency fracture. It's a pelvic fracture. You'll see in Honda sign. It's the line running vertically through both the sacroiliac and also medial. So if you see a Honda sign, it's typical for sacral fracture. Yamuk sign, skull metastasis, Paget's disease, Hashimoto's disease, or radioactive contamination. This is on a bone scan. Well done. 38% says Paget's disease. It is Paget's disease. In fact, it's a combination of osteolytic and osteosclerotic changes. There's a central photon deficient area, rim of uptake, classical. It is seen in Paget's disease. It was reported somewhere in 1991. Push. If it doesn't work, pull. If it doesn't work, it means the shop is closed. So you have to be careful. So if you go to a shop, try pulling and pushing. If it's not working, so it means you have to go back home. All right? So, coming to hourglass sign, horseshoe kidney, fused ectopic kidney is a renal mass on a renogram, or you're going to see a photon deficient area. Could be related to renal stone on a MAC3 renogram or a DTPA scan. Very good. It's fused ectopic kidney. In fact, it's a fused non-obstructive pelvic kidney. Two kidneys fused together, draining into the bladder. So it looks like an hourglass. So it was coined as hourglass sign sometime in 2005 in Annals of Nuclear Medicine. Fissure sign is quite straightforward. On a VQ scan, if you see a fissure sign, it indicates pleural effusion, COPD, pulmonary embolism, or it's a normal variant. This is on a planar VQ scan. In fact, specs changed quite a lot. You pick up fissures very frequently in PET inspect. Well done. At least 50% are really good. It's pleural effusion, the linear area of reduced uptake. It could be due to the fluid in the fissure. It appears as a fissure, therefore it's a rim sign. On a HIDA scan, it indicates a normal variant, complicated acute cholecystitis, chronic cholecystitis, or a biliary leak. If we see a rim sign, again, it's complicated acute cholecystitis. 50% of them got it right. If you see that sign, you have to call your surgeon. Seat belt sign. Rupture of lungs, rib fractures, rupture to spleen, or fracture of sternum. Seat belt sign. Good, I didn't coin all these things because I will be a joker here standing. Well done. Somebody is really good in the crowd. 57%. They say rib fractures. Again, it can be due to a seat belt or non-seat belt wearers, or people can get injury hitting the steering. But altogether, if there's a fracture of ribs in a linear fashion, it is a seat belt sign. Butterfly sign. Hyperostosis frontalis, skull metastasis, Paget's disease of skull, brain metastasis on an FDG scan. Butterfly sign. Just enjoy, okay? Don't think too much about all these things. This is purely entertainment. 42% are right. It's hyperostosis frontalis. It's also seen on an X-ray, as well as sometimes in the bone scan. Common in patients with increased bone metabolism or disordered bone metabolism. This is another, teach your kids about taxes, eat 30% of their ice cream, and then they understand what taxation means. From the early age, you buy something, but you can take a share of it, right? Then they understand taxation. Coming to donut sign, it's seen in avian, aneurysmal bone cyst, giant cell tumor, osteoblastoma. If you see a donut sign, probably it's got multiple answers because it's a very non-specific sign. You can see in multiple pathologies. In this case, you can see in avian, giant cell tumor, aneurysmal bone cyst, meningiomas, all can appear. It's a very non-specific finding. You need further correlation for definitive diagnosis. Owl's eye sign on a thyroid scan, whether it indicates papillary cancer, functioning nodule, cyst, or all the above. This was one of the first signs somewhere in 1970. First sign in nuclear medicine is an owl's eye sign. It's very easy when you say all the above, we'll say all the above. It's right. It's a very non-specific again. Thyroid cyst, functioning nodule, papillary carcinoma of thyroid. And they have reported in quite a lot of journals. And the first time it was sometime in 1970. And then again in 76. PET chelarity sign on a PET scan, whether it's due to a colon loop between the liver and the diaphragm, liver metastasis, pleural effusion, or lung metastasis. Brilliant. So it's the presence of a colon between the liver and the diaphragm. It's an anatomical variant, and often, if you don't understand, you can misinterpret the finding. Push-up sign. Which muscle is involved? Pectoral muscle, rectus abdominis, upper limb musculature, or deltoid. Pectoral muscle uptake, again, it's likely due to extracellular fluid expansion, increased cellularity. You often see this in the bone scan as well as in PET. Helmet sign, Paget's disease, radioactive iodine contamination, skull metastasis, none of these. They reported helmet sign. After this session, we can coin another sign here. You can always. Answer is radioactive contamination. In fact, most of the people who go to weaving of the hair, they put quite a lot of gel. And few patients, after having that hair treatment done, they went on to have radioiodine treatment. So when they sweat, it all gets into it doesn't evaporate, and it's seen as in radioiodine scan. And people have went on to do SPECT CT, and in fact, even in planar, it's all in the scalp, not in the bone. So it's just radioactive contamination. Physiological uptake. Men to the left, because women are always right. It's fantastic, I get so tie sign and a striped tie sign. A tie sign. We'll go for the tie sign on a bone scan, whether it's due to external metastasis, is it a normal variant, it's an artifact, or it's commonly seen in metabolic bone disease. Good. Metabolic bone disease is the answer. You'll see prominent uptake. It's not an isolated finding, but you'll have some increased uptake in the calvarium, mandible, sternum, costochondral junctions. All are indicators of metabolic bone disease. Pituitary sign on a pentavalent DMSA scan. Is it metastasis or normal distribution, or calcified pineal gland, or adenoma? In fact, this similar patterns have been reported in gallium dotatok also. If you see an uptake in the pituitary gland, whether it's normal or abnormal. At least Guy's Hospital's got one sign named after them, so this is one of the signs I think so somebody reported from Guy's. The answer is it's a normal distribution. It is seen in 25% of the patients. If you see focal uptake on a pentavalent DMSA, it's normal. Saddle sign is again whether it's muscle injury or inflammatory or infection or fracture. If you see this on a bone scan, commonly seen in jockeys, that's why it's called saddle sign. Good. It's due to repeated muscle injury in patients, so that's the commonest cause. You'll see some increased uptake in the thighs, and it's again reported sometime in 2004. Clinical nuclear medicine, which is famous for taking signs like this, but now they become quite stricter. They don't take everything; they do reject. So this is one of the signs. Sit-up sign is again one of the muscles, whether it's pectoral, rectus abdominis, deltoid, or gluteus maximus. This is on a bone scan, not on a PET. It could be similar on a sit-up scan. Name the muscle. It depends on how you do the sit-up or a stand-up. Hot rectus abdominis muscle, so is the commonest cause. Cobra head sign, again, this was published in Pakistan Journal of Nuclear Medicine. The editor-in-chief is there, you should ask him. Cobra head sign. It's on a MAC3 renogram, whether it indicates urethrocoel or duplex kidney or VUR or a bladder tumor. Cobra head sign. It really looks like a cobra when I show the scan. It is a urethrocoel, hydronephrotic kidney with a hydroureter associated with sacral aortic perching. This was reported to be as a cobra sign. Alcohol may not solve your problems, but neither will water or milk. So whatever you choose, it's not going to solve your problem. So just live life, enjoy it. Double density sign. Osteoid-osteoma, AVN, bone metastasis, giant cell tumor. If you see double density sign, again on a bone scan, often you can get a diagnosis. Most of the time it's right. I want to finish fast so that I can give chance for a real quiz from Eric. That's where it's challenging. This is purely entertainment. The answer is osteoid-osteoma, which is right. Consists of central chorovascular osteoid tissue. That's the right answer. Hot skull sign. Even I'm not very sure about it, but they have reported this. Paget's disease of skull, skull metastasis, hyperostosis frontalis, or disparate soft tissue attenuation. So if you see something like an increased uptake in the skull, the remaining part of the body shows relatively reduced uptake. What is the reason? The answer is number 4. What happens is when you inject a radiotracer into an obese patient, often there will be quite a lot of soft tissue attenuation in the entire body except the skull, and therefore the skull looks more hotter than the remaining body, so don't ask for extra investigations. So just see how obese the patient are. The skull is hot, but don't worry about it. It's normal. Raccoon eye sign. PET lymphoma, MIBG, neuroblastoma, CT scan, or an octreous scan is a normal variant, or a sarcoid on a gallium scan. Answer is MIBG. There is uptake around the orbit. It's metastatic disease. And it will be mostly in a CT scan where the entire skeleton will be seen. There is increased uptake in the orbits, indicating metastatic disease. Mahaved sign on myocardial perfusion imaging. What does it indicate? On a myocardial scan, if you see this sign, D sign, if the left ventricle is D-shaped, what is the cause? Is it pulmonary hypertension, chronic PE, high right ventricular pressure, or RV dysfunction? It's a tricky one because the answer is all the 4. Even chronic pulmonary embolism will lead to pulmonary hypertension and right ventricular failure. And they say if you see a D-shaped ventricle, it's an indirect indicator that patient has got a high pulmonary arterial pressure. And you'll see uptake in the right ventricle, and the left ventricle will be D-shaped. Last of the signs, the signet ring sign on a MAC3 renal scan. Again, from Pakistan Journal of Nuclear Medicine. The editor-in-chief is there. Any questions, it's directed to him. Any signs? Again, on a MAC3 scan, is it a duplex kidney or mild rotated and dilated system? Is it a renal stone or a reflux? But again, even for me, it was confusing. And I saw this, I thought I would have reported it the other way around. But when I see the image, I thought it could be a duplex kidney with non-functioning lower moiety, but the answer is malrotated and dilated. In this case, as you can see, the ultrasound, there is only dilatation. There is no evidence of a duplex system. Only the lower pole shows reduced uptake, and it shows a signet ring sign. Last of the sign, rugged jersey sign. Again, it's more of a radiological sign, but recently we did a SPECT CT and we could make a diagnosis. Where do you see the sign? Paget's disease, multiple vertebral fractures, osteopetrosis or osteoporosis. Rugged jersey sign. Or they call it a sandwich. Again, it's a sandwich vertebra, sandwich sign they call it. Or bone within bone. The answer is osteopetrosis. It's a classical finding. There'll be a sclerosis and a central reduction, so there'll be a bone within bone sign, sandwich appearance. It's diagnostic of osteopetrosis. Again, they often ask for bone scan. Bone scan is only to detect any fractures due to metabolic disease. And they do show marrow hyperplasia, secondary to anemia and all sorts of endothelial and hyperplasia. So bone scan is done only to see if there is any metabolic fractures. In this case, the patient had bilateral femoral fractures and also a few ribs. So thanks to all the journals. But again, I'm going to repeat, I never made the science. So all I'm trying here to do entertain you. And that's the end of it. I hope you enjoyed.